Hello everyone, I hope you all are doing great. Today we will learn about obturating material, which is the most important part of the dentistry in filling and sealing of the root canal for successful treatment. Obturation is the method used to fill and seal a cleaned and shaped root canal using a root canal sealer and core filling material. The function of the root canal filling is to obturate the canal and eliminate all portals of entry between periodontium and the root canal. The better the seal, the better the prognosis of the tooth. The obturating material, that is the ideal root canal filling material, should be easily introduced into the root canal. It should be seal the canal laterally as well as apically. It should not shrink. It should set slowly. It should not allow air, moisture and fluid to pass through. It should be bactericidal, radio opaque. It should not stain the tooth structure. It should not irritate the periradicular tissues. It should be sterilized and easily sterilized immediately before insertion. It should be easily removable from the root canal if necessary. A root canal may be obturated when the tooth is asymptomatic and root canal is reasonably dry. Optimal shaping and cleaning of the canal can be easily achieved in a single sitting in a tooth with vital pulp tissue. The canal should be reasonably dry after completion of the shaping and cleaning protocols, with no weeping of the fluid in the form of bleeding or discharge of serous fluid. When there is seepage into the canals is excessive, it can be treated by eliminating and enlarging the canal and irrigating and sealing it with intracanal medicaments such as calcium hydroxide paste. There is a classification of endodontic obturating material. Historically, silver points are used. Currently available is gutta-percha, MTA, mineral trioxide aggregate, resilient. Silver points are no longer recommended in endodontic practice because of the following reason: because it is a rigid material. Silver points start corroding when they came into contact with saliva or periradicular fluids. The corrosion products are toxic and lead to the failure of the endodontically treated tooth. It is used to fill root canal historically. A silver point is stiffer than gutta percha. It can easily inserted into fine or tortuous canal. Currently used solid core filling materials are gutta percha. It is developed by Hill. Bowman demonstrated the use of the gutta percha in root canal filling. White Company is manufacturer of the gutta percha points. Composition of the gutta percha: 20% gutta percha, which is matrix, 65% zinc oxide, which is filler, 10% heavy metal sulfate, which is radio pacifier, 5% waxes or resin, which is plasticizer. Its characteristics are: it is a rigid natural latex produced from a sap of the rubber tree of genus Palacoinum. It is a trans isomer of polyisoprene and exists in alpha and beta crystalline form. The material is solid in the beta phase and does not shrink. On heating the material, the beta phase changes into the alpha phase, which is tacky and flowable under pressure. The solid mass alpha phase gutta percha melts at a temperature above 65 degree and turns into the beta phase on slowly cooling. This exhibits less shrinkage and more dimensional stability. It does not shrink after insertion. It is easily sterilized prior to the insertion and does not encourage bacterial growth. It is radio-opaque, non-staining, and impervious to moisture. It can be removed easily if necessary. It is probably the least toxic and less irritating root canal filling material. Its sizes are extra fine, fine, medium, large, and extra large. Due to the poor sealing property of the gutta-percha, regardless of the technique, it must be combined with the root canal sealer to ensure proper filling and sealing of the root canal. Next is MTA, mineral trioxide aggregate. MTA can be used as canal obturating material because of its superior physiochemical and bioactive properties. It can be used in teeth with open apices. It can be used in internal resorption and dents in dente. Its limitation is it can't be used in curved canals. Potential for discoloration, especially when used in interior aesthetic zone. Next one is a Resilon. Resilon is core material with difunctional methacrylate resin, bioactive glass, bismuth, and barium salts as filler and pigments. This system can be placed using lateral compaction, warm, vertical compaction, thermoplasticide injection techniques. Resilon require 150 plus temperature for thermoplasticide technique, which is less when compared to the 200 degrees Celsius temperature required by normal gutta percha.